Three.
Hello, Nursing 450 Nursing Leadership. Today our group is happy to present to you our presentation on access to care. Michelle Cho, Khalif Dantzler, Victor De Leon, Nicole Escalera, and Bonnie Ferreira for Cal State San Marcos. We will be discussing Americans' access to care, some barriers to receiving care, but what we felt was the largest barrier was lack of adequate insurance coverage. We'll share our position statement, provide you with the theory that guided our research. We will also have relevant research and statistics related to access to care, an expert interview, and our action plan to improve access to care. Finally, we will leave you with our suggestions for improving access to care for millions of Americans.
United States ranked number 1 for gross domestic products in the world again in 2017. America is the wealthiest country in the world, but it did not offer universal health care for the citizens till 2010. USA is 33rd country to offer universal health coverage. In 2010, President Obama signed Affordable Care Act, which made insurance companies cannot deny insurers due to pre-existing condition, age, or gender. And all individuals are mandated to get coverage regardless of their income. For individuals with low income, government subsidies were available to lower the cost of insurance. Penalty will impose for insurance companies denying coverage, and individual will tax with penalty with no insurance coverage. With help of Affordable Care Act, uninsured Americans declined dramatically. CDC reports on uninsured Americans dropped from 16% in 2010 to 9% in 2016. However, the number is equivalent to 28.9 million Americans without health insurance. The biggest drawback is high cost of insurance, high cost of copays, and coverage of unnecessary services.
Our position statement is, we believe all Americans should have access to universal health coverage. As Bonnie and Michelle discussed, many people are denied the right to health insurance due to circumstances beyond their control. Some of the factors that hinder adequate, equitable, and timely access to quality care include insurance coverage or lack thereof, financial resources, homelessness, mental illness, transportation, language barrier, proximity to healthcare provider, discrimination, cultural beliefs, cultural disconnect, health illiteracy, immigration status, and others. These factors can lead to health disparities, which can contribute to higher rates of illness, disability, and death in minority and underserved communities. Our presentation today will discuss access to care as one of the largest barriers in depth and consider the contribution that nurses as leaders in the healthcare system can make towards improving access for all.
Our focus as nurse leaders should be on improving access to care by improving availability and affordability of health insurance. To accomplish this, it would be necessary for us as leaders to do more than just lead within our healthcare organizations. Making these drastic changes would require changes to our healthcare system as a country, not just our healthcare organizations. The theory we chose was lateral leadership. It's defined by dynamic approach to leadership, and it focuses on network, constructive persuasion, consultation, and coalition building. Lateral leadership would require nurse leaders to work within and out of their organizations to achieve wide-reaching goals. They could work with local, state, and national representatives to improve access to care by improving health insurance coverage. Once changes have been implemented nationwide, it would still require the nurse leader to work within their organization to ensure that these changes are reaching patients. Improving access to care through health insurance coverage is a huge problem to tackle, and it would take a multifaceted and dynamic nurse leader to help make these monumental changes.
Today, there is still a significant number of people that are uninsured. That number is currently 28.9 million people that are uninsured. Before the Affordable Care Act was passed in the year 2010, there were 48.6 million people that were uninsured. One of the principal reasons that many people are uninsured is because of the high cost of health insurance. Many uninsured people come from working families who essentially are in a gray area of affordability. They make too little money to be able to afford health insurance out of pocket and make too much money to qualify for government insurance programs like Medicaid, also known as Medi-Cal here in California. Young adults in the age range of 18 to 35 years old cannot afford health insurance because they don't make enough money. Administrative costs in U.S. hospitals are the highest than in any other nation. This is also part of the problem of the U.S. healthcare system. High hospital administrative costs have an impact on insurance plans and make the plans less affordable for many people because it drives prices up. Additionally, consumer-directed plans have been found to have high cost deductibles. There is particular concern regarding healthcare access for families with low incomes or family members that have high-cost chronic conditions, who may face higher costs under consumer-directed plans. Low-income families that are employer health insurance are moving their children to public health insurance options. This is due to insurance premiums that continue to increase. The average contribution to premiums for family coverage reached $4,565 in 2013. The uninsured can pay for primary care out of pocket, but they must pay cash, and discounts on price or flexibility of payment timing are often not an option. This leads people to skip care they desperately need. This highlights what is already well known. The uninsured receive less care, have worse clinical outcomes, and experience more financial burdens compared to people with either Medicaid or private insurance. The numbers of uninsured people will continue to grow unless universal health care for all is made available. More people are losing their employer-sponsored health care. From the year 2000 to the year 2015, there was a 9.9% loss of people who lost their employer-sponsored healthcare insurance. That is almost a 10% difference. There are significant disparities in access to healthcare as well. People that are poor, African American, and Hispanic are less likely to have health insurance. Universal healthcare for all would correct these disparities. The answer to getting healthcare coverage for the uninsured is universal healthcare for all. Universal healthcare would expand coverage to 28.3 million people. Universal healthcare coverage would have a significant benefit for the poor. They would receive considerably more in health services than they do today, with no out-of-pocket costs. Higher income people also would receive the benefits from comprehensive insurance coverage with no cost-sharing requirements and would no longer have to pay premiums for private coverage. However, their benefit improvements would be more modest given their current coverage, and they may find it harder to access providers because of supply constraints.
Next, I'll discuss the interview. I interviewed Rochelle Conger, PT, DPT, MBA, Chief Operating Officer at Martin Luther King Jr. Outpatient Center. Unfortunately, I was unable to complete my original interview with Dr. Soni, who is a primary care physician and Director of Continuity of Care at MLK, a DHS facility located in the Willowbrook area of Los Angeles, as she is on medical leave. However, on Tuesday, July 31st, 2018, I was able to secure an interview with Ms. Conger. Ms. Conger has been with MLK for 33 years. When asked why she chose this as her life's work, she replied, "I wanted patients to receive the best therapy, even if they could no longer pay for the best." afford to pay for the best. This facility serves as a safety net population, which before the ACA was predominantly Medi-Cal and uninsured. The Institute of Medicine defines safety net providers as those by mandate or mission who offer access to care regardless of a patient's ability to pay, and whose patient population includes a substantial share of uninsured, Medicaid, and other vulnerable patients. Now, almost everyone is eligible for coverage under the ACA. This interview was arranged with the assistance of my facilitator, Dola Akrele, nurse manager at MLK OPC. One of the first questions that I asked Ms. Conger was, what will the changes that the current administration is trying to make do for the safety net population and underserved, predominantly minority populations, for example, those with pre-existing conditions? According to the AHRQ, provisions to increase health insurance options for young adults, early retirees, and Americans with pre-existing conditions were implemented in 2010 with the Affordable Care Act. Ms. Conger states in response to my question, the changes will hinder efforts to address health disparities for this population. Some will lose coverage and others will delay seeking services and coverage due to their inability to meet the financial obligations associated with their care, including copays, share costs, pharmaceuticals, etc. The delay in accessing care may result in less favorable outcomes and premature death. Patients may also avoid seeking care because of fear of immigration. It is especially concerning the impact this will have on children and adolescents, those most vulnerable. As Bonnie stated earlier, the nurse leader must work diligently and collaboratively within their organization to ensure that they and their nursing colleagues and staff are supporting efforts to provide the best, most cost-efficient, evidence-based care for their patients. Working to the top of our skill set, empowering patients and their families to become engaged and involved in their care and decision-making, continuous quality improvement, supporting a safe and just culture, and working to ensure customer satisfaction are ways by which we can succeed in this mission. Earlier, Victor reported significant disparities as referenced by an AHRQ report that stated Blacks and Hispanics were more likely to be uninsured than whites. Though promisingly, Black, white, and Hispanic white gaps in uninsurance decreased over the 2010 to 2015 year period, as well as improvements in having a usual place to go for medical care, which is a measure of realized access. Next, we discuss some of the innovative ways that MLK OPC addresses the barriers to access to care in the community. DHS, which is the Department of Health Services, is committed to identifying and implementing strategies to ensure success in fulfilling its mission. Here, I list some of the services that are offered at MLK to help expand access and support the needs of the community. More information can be found at their website, which is referenced here. Some of the implementations that they have done to improve or reduce barriers to access to care include extended clinic hours on evening and weekend appointments, alternate appointment types including group classes and nurse-only visits, culturally sensitive services, and new clinic openings, along with the Community Health Workers Program. The next question I had for Ms. Conger was, is the medical healthcare community in support of or against an overhaul of the ACA? Ms. Conger feels that the medical community, especially those that serve the underserved population, is in support of the ACA. They acknowledge that as it is, the ACA is not perfect, but things are better for these communities with the ACA than without it. Those not mission-driven support the ACA because of financial gain. This reminded her of the change that took place when Medi-Cal expanded coverage for obstetrics. Prior to the expansion, safety net hospitals had little competition for obstetrics. The number of births at the facility were astounding, she said. After the expansion, safety net hospitals had to compete for these same patients. The final thought from my interview is pretty much summed up here with this mural that is on one of the buildings at the Charles Jr. University, which is on the MLK campus. It is an image of Dr. Martin Luther King Jr. and a quote as shown here, which says, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." This statement remains as fitting today as it was back in 1966 when he spoke these words. Ms. Conger and I discussed the future of the ACA, and she expressed hope that the ACA will remain, as well as reiterated her thoughts on its importance to all Americans. On the current administration, she shared, although they have been successful in weakening certain components of the law, it will not be overturned. The ACA is not perfect, but it has made a significant difference to a large portion of the population that did not have coverage. With time, improvements will be made to address gaps and improve the ACA. Ms. Conger also left me with a final profound thought, which sums up the needs of communities like Willowbrook around the country. In order to fully eliminate health disparities, the ACA alone is not the answer. All contributing factors, which include social and economic inequities, including poverty, housing, employment, and education, must be addressed.
We need to take action. Everyone deserves to have a right to have access to care. As nurses, we have the ability to advocate for patients and their right to care, as nursing is one of the most respected careers. Being that said, nurses have the advantage of using their voices to speak up and take action. Nurses can get actively involved, ranging from writing a letter or making a phone call to local congressmen, legislators, or policymakers. For better chances of getting voices heard, nurses who advocate in numbers or within organizations such as the American Nurses Association will have a better chance for success. The ANA at the highest level advocates for policymakers to recognize the true value of nursing and the unique perspectives nurses have to offer. Alone in 2017, the ANA was 3 times instrumental in stopping the passage of legislation that would undermine the current healthcare delivery system, impacting nurses and their patients. Lastly, nurses can educate the public by working with organizations to set up public meetings to inform the public and how they can get access to care. Thank you all for listening to our presentation, and we look forward to being nurse leaders. Here's some of our references.